In July 1993, Nigeria's Federal Ministry of Health gave the report that 5.5 million Nigerians were affected by high blood pressure. Today, the World Health Organization reports that 1 out of every 3 persons in the world is hypertensive. And of that total figure, a staggering 56 million Nigerians suffer from the silent killer that is hypertension. Scary. On this episode of Channels Discovery, we examine the nature, causes and effects of hypertension. We examine the many reasons why Nigerians, young and old, are so prone to this condition, why it lives up to its label as a silent killer with its ability to creep up on an unsuspecting population despite the best efforts of medical bodies at home and abroad. I'm James Laide and you're watching Channel Discovery. Hypertension is the leading cause of stroke and a major cause of heart attacks. According to the World Health Organization's Global Status Report, Africa has the highest count of hypertension cases, estimated to be 46% of adults aged 25 and above. When we bring that home, right here in Nigeria, it translates to over 56 million Nigerians suffering from hypertension without even knowing. My first point of call was the Community Hospital, Lagos State University Teaching Hospital, where I met with Dr. Awubusuyi, a cardiologist who seems to see the heart of the matter. Doctor, what exactly is hypertension?
Well, hypertension is that disease condition in which the blood pressure of an individual is higher than normal.
How difficult is it for somebody, say, who just walked in off the street, coming in here to LASUTH, and they wanted to get a reading on their blood pressure? How easy is it, or difficult?
It's very easy, and as part of the effort of most hospitals in screening hypertension, practically all patients who register have their blood pressures taken as part of
the vitals,
the vital sign.
You find that a lot of Africans, Nigerians in particular, don't really like going for routine checkups. Like we don't want to know what's wrong with us as long as there's nothing, that's serious and we can get out of bed. We really don't want to know if we have any condition until it's too late most of the time.
Yeah. It's a very serious issue that's the medical community is giving us a lot of concern. I think it's also part of our perception of the disease process, and the fact that many people also have this denial. You're told you have an illness, and the next thing is to probably say you reject it or some kind of yeah, and that's actually hasn't helped issues. Yes, you made a diagnosis, you've given some counseling as to how severe the disease is, what needs to be done, and the patient goes home and the next thing is he rejects.
But heaven helps those who help themselves.
Yeah, heaven helps those who help themselves, but the fact that he has rejected it and not taken the appropriate therapy doesn't sort of exonerate us because if he develops stroke, for instance, it will affect his family directly. It's going to affect the community in one way or the other. So we still have that responsibility to ensure that he sees reason as to why it's necessary to, get treated.
The World Health Organization, the Nigerian Heart Foundation, LASUTH, as well as other health NGOs have been pushing for, more blood pressure awareness with Within Nigeria, Africa at large, why do you think that Africans are not really taking their blood pressure that seriously?
Well, I guess we still need to do more. We still need to make people realize that although you don't have symptoms, hypertension is still very dangerous, and that it could lead to very severe complications that can cause death. Even if the patient, doesn't die, the costs of managing those complications are quite enormous. The disease doesn't manifest itself clinically until whether the individual takes his blood pressure.
Meaning there are no symptoms?
There are no symptoms. And occasionally, the patient just comes in with complications of hypertension, which are quite severe. So a patient who assumes that he or she is normal and carries on with his or her business can suddenly come down with a stroke because his blood pressure has not been checked for quite a long time. And that's why it's called a silent killer.
All right, Dr. Awubusi, thank you very much for your time, sir. Thank you. Statistics carried out by the World Health Organization show that 1 out of every 3 persons around the globe are hypertensive, a situation which they say could become detrimental to the survival of mankind itself. In Nigeria, it's 4 out of every 5 adults. We needed to find out more about how to treat this devastating condition, so I went in search of expert opinion at Reddington Hospital, Lagos, a multi-specialist medical center in the field of cardiology here in Victoria Island, Lagos. Doctor, how serious is high blood pressure as a condition?
Hypertension or high blood pressure is one of the leading causes of heart and kidney disease that leads to the major complications of stroke, heart attack, kidney failure, heart failure. This results from end organ damage, vascular damage, blood vessel damage, especially the microvasculature or the very small blood vessels. It results in damage to the organs, such as the eye, which causes blindness. It can cause impotence, narrowing of the coronary arteries, which leads to heart attack, narrowing of the carotid arteries in your neck, leading to the brain, which can lead to stroke. In Nigeria, it's estimated that 57 million people have hypertension.
That many?
That many, with many still undiagnosed for a variety of reasons. Lack of access, ignorance, meaning that people don't want to know if they have medical conditions, including high blood pressure. So you can see that it's a huge public health problem in Nigeria.
And what sort of person is typically most at risk to have high blood pressure?
Well, men have a higher incidence than women. Obese people have a higher incidence than thin people. People that eat salty foods have a higher incidence than people that don't. People that smoke have a higher incidence than people that don't smoke. And people that lead a sedentary lifestyle, like many business people, have a higher incidence than people that exercise regularly.
So typically, what is the scenario in terms of, could you describe rather, the damage that high blood pressure could cause to the body, the human body?
Well, as I said, it does affect all the blood vessels in your body. And the ones that have involvement of the small blood vessels, for instance, might cause blockage, which can lead to damage to the retina, which can lead to blindness. In the kidney, the microvasculature or small blood vessels are affected, which leads to decreased blood flow to the kidneys, decreased function, eventually renal failure, kidney failure, which in order to live, we most likely would need to go on dialysis.
Wow.
So in Nigeria, it's one of the leading reasons that people are on dialysis is complications related to hypertension and then also related to diabetes. Okay, Sister Chica is doing a blood pressure reading on you now. You can see it's very quick and it's painless, a painless procedure. This is the actual procedure to take the blood pressure. You get a reading of one number over another number. The top number is called the systolic blood pressure, and the bottom number is the diastolic blood pressure. The systolic blood pressure measures the pressure in your blood vessels when the heart is contracting, and the diastolic measures the pressure within your blood vessels when the heart is relaxing. And those numbers are read out, for an example, as 140 over 90, which is the top limit of normal. If you're a diabetic, they generally recommend it's 135 over 95. And it's kind of an interesting story how they arrived at that number. Medical people did not arrive at that number. That was done by an insurance actuary who, when he was examining thousands of people that had a physical before life insurance policy, he found that people whose blood pressure was higher than 140 over 90 had a much higher risk of disease than those that had it lower. So it was actually done from a non-medical way that the insurers would figure out that, you know, these people are at higher risk, these people are at lower risk, and so the medical field adopted those numbers.
Okay, so what are my numbers, and am I healthy?
What was the number?
120 over 80.
Perfect.
Really?
Excellent, excellent numbers, yeah. 140 over 90 is what we consider the top limit
fit.
of normal. So yeah, very good.
But I mean, the point is you need to do regular checkups to make sure that you are fit and healthy, right?
People over the age of 40 should get it done at least once a year.
At least once a year.
And if it's ever found that the blood pressure is elevated, then it should be done more frequently. Now, I think most physicians wouldn't actually treat you based on one blood pressure reading.
So you might have to come back for a follow-up.
Correct. Or maybe blood pressure readings in a neutral setting. So for instance, maybe somebody comes here for one reason, but they have a nurse at their workplace. So I would tell them, get some blood pressure readings at work with the nurse, you know, in a quiet setting, and then have recorded so that me or a physician can check those out. Now, one of the things that the problem we have is in Victoria Island with the traffic and business people being in a hurry, sometimes you get people and they want to come in real quick and get their blood pressure checked. You know, the doctor told me to get my blood pressure checked. That's the worst thing to do. Come in, you should sit down, relax, and then have the blood pressure taken in order to get a valid reading.
So doctor, is high blood pressure preventable, and how is it treated?
High blood pressure is eminently treatable. 90 to 95% of people with high blood pressure have what's called essential hypertension, which means that it's part of their innate nature or their genetic makeup. So those people are prone to get high blood pressure. Now, there are modifying factors that can accelerate the onset of high blood pressure.
Such as?
Obesity,
being
smoking, being overweight, smoking, having a sedentary lifestyle, actually living in an urban area versus a rural area. And that's not just for Nigeria, but that's across the countries.
Like increase in stress?
Increase in stress, change from a more traditional diet to a diet that's likely higher in fatty foods and higher in processed foods, which are all bad for high blood pressure. The other thing is salty foods increase the blood pressure.
And why is it referred to sometimes as a silent killer?
It's referred to this as a silent killer because very often people have no symptoms, and then they might go to a doctor's office or they might go to a screening, and all of a sudden they're noted to have high blood pressure.
Wow.
So it's not the type of thing that normally people say, "Doc, I'm feeling badly, and so I need to get my blood pressure checked." It's the type of thing that you don't know about it.
Wow. Well, this is definitely going to make me take more precautions and try and live a healthier lifestyle. Dr. Susi, thank you very much for your time, sir.
James, there's no
Appreciate it.
problem. Happy to be of help.
With regards to healthcare in Africa, how affordable are these high-value services becoming to the average African?
At the moment, most Africans are embracing HMO, which is